EMS, hey sir, my name is Sam with MCHD. This is my partner Aaron. What seems to be going on today?
Oh, bad chest pain, shortness of breath.
Okay, alrighty.
Plus,
Aaron,
having trouble breathing.
can I borrow this really quickly? Alrighty, sir. I'm just gonna listen to your lungs really quick. Can you take a deep breath for me? Another deep breath. And again. One more time. Alrighty. Lung sounds clear and equal bilaterally. Alrighty. So I see I only have one patient. I'm not going to call for additional resources at this time. My patient is awake, alert, responsive, and talking to me, which is great, which means his airway is open. GCS of 15. I don't see any obvious life threats. Alrighty. And if you can you get a blood pressure, pulse ox, and hook him up to a 12 lead while I ask some questions?
Okay. Let's see your finger, sir. And your arm.
And then when you're done with that, and I get all my numbers, we're gonna head into the truck, alright? Alrighty, sir. So what were you doing when all this happened? You were mowing your lawn?
Yeah, I was mowing the lawn.
No! Do you mind getting a set of vitals for me? I need a blood pressure, SpO2, pulse ox, and if you can you hook him up to a 12 lead while I ask him some more questions? The scene is safe. Alrighty. So, other than your chest pain, is anything else going on?
No.
Alrighty. Did you take any medication prior to us arriving?
No.
Okay. Alrighty. So, depending on how your blood pressure turns out, I might need to give you a medication. And this medication might have some adverse effects if you've taken any ED medication. If you've taken any ED medication, and I need you to be honest with me.
No.
Thank you, sir. Alright. So, are you allergic to any medications?
Penicillin.
Alrighty. Any previous medical history?
No.
Nothing whatsoever?
No.
Okay. So, back to your chest pain. On a scale of 1 to 10, how bad is your chest pain currently?
Oh, about an 8.
Okay.
180 over 90.
Okay, that's good. Alrighty.
We'll just keep this on.
Just in case. Okay. And O2, 99%. Heart rate about 130. Okay. Alrighty. So we're gonna transfer into the back of the ambulance right now. Do you feel okay taking a couple steps for me?
Sure.
Okay. Alrighty, sir. So Aaron, he is currently having a STEMI. I need you to drive as fast as you possibly can to Memorial Hermann, lights and sirens, the works, okay? So sir, that picture of your heart, that 12 lead that my partner got, it showed that you had ST elevation in leads 2, 3, and AVF. So we need to get you to the hospital as soon as we can. You are in wonderful hands, and we are taking you to a place that has wonderful equipment, and they can take care of you there, okay? Alrighty. So, back to this pain that you are currently having. Does it come and go, or is it constant?
Pretty constant.
Okay. Are you allergic to any medications?
Penicillin.
Penicillin? Alrighty, sir. So I'm going to give you some baby aspirin. I'm going to give you 4 of them. And that equals 325 milligrams. And I'm going to give them to you. I need you to chew them, okay? Here you go. Can you chew them for me? So I'm going to ask you a little bit more about your chest pain, okay? Alrighty. So, when did this all start?
When I was mowing the lawn, having a cigarette.
About, how long would you say? About 30 minutes?
About a half an hour ago.
Okay. Alrighty. Alrighty. Does the pain go anywhere?
No, it's pretty much just
Just
in my chest.
stays in your chest? Okay. I'm going to start an IV on you. I'm starting an 18 gauge in the patient's left forearm, making sure it's patent, making sure I get good blood return, and making sure it flushes perfectly, all good. And now I'm going to be giving you some Zofran. I'm giving you 4 milligrams of Zofran. This is an anti-nausea medication because you seem to be in a lot of pain.
Oh, I am.
And the pain medication I'm going to give you will make you nauseous. Okay? So here's the Zofran going in. And I am flushing the Zofran. And now I'm giving 4 milligrams of morphine. And now I'm flushing the morphine through the line. And now I'm going to ask you how old you are. How old are you, sir?
64.
Okay. Alrighty. So now I'm going to call report to the hospital. Memorial Hermann, this is MCHD Medic 1. I have a 64-year-old male, complains of crushing chest pain. His 12 leads showed ST elevations in leads 2, 3, and AVF, aspirin, nitro, and 4 milligrams of Zofran and 4 milligrams of morphine have been administered through an 18 gauge in the left forearm. His last vital signs were 180 over 90, heart rate 120, O2 99 on room air. Do you have any questions for me at this time?
No.
All right, thank you. We will see you in about 5 minutes.